Morning everyone, I'm the fourth year resident Seok Lee. Also, I had a very great chance because professors and my colleagues gave me a chance to go to Kyrgyzstan for 1 week. And this is the presentation for the mission that we went to Kyrgyzstan. So my first memory of Kyrgyzstan came from Professor Choi. The mission to Kyrgyzstan first started 2 to 3 years before, and Professor Seok went to Kyrgyzstan and brought this baby to Professor Choi for nose reconstruction. And I was a resident of Professor Choi at that time, and we did the nose reconstruction, and this was also in the news. So after I got a chance to go, and many of you can know that Kyrgyzstan has a total population of 7.1 million, while you can compare it because Seoul has a 10 million population. And the capital city is Bishkek. We went to Bishkek and it has 1.1 million. To go to Bishkek, the flight is about 7 hours. We had a one-way flight and we went to Bishkek. This is when we arrived. Total 5 of us went to the mission. Professor Seok, Professor Jung, Professor Kim, and the nurse in the OR, Kang Yesil, and me. So this is the national flag of Kyrgyzstan. They are a country of nomads. So if you can see the flag, there are 40 spikes of yellow spikes. It means the 40 tribes, and also Kyrgyz means 40 tribes. So it has the meaning of nomad in both the name and both their flag. Also, this is a traditional house that we saw in Kyrgyzstan. They can, by their definition, they can pack it in 30 minutes and make the home again in 30 minutes. So this is the home for nomads, and if you see in the upside, you can see the tent, and this is the flag meaning. So this is the first photo I took from our house where we were sleeping. This was my first memory of Kyrgyzstan. Very Mother Nature, very big Mother Nature, very big mountains, very good weather with no humidity and many trees in the city. Also, there's some flag signs that saying be careful of the cows, and we can also see cows in the roads, and also Korean taxis on the roads. So this was a medical missionary which was led by Professor Peter. So this is the hospital entrance we got in. This was a place for corona patients in 2019 and 2020. We went to the National Hospital of Kyrgyzstan, and in Kyrgyzstan there's 2 hospitals. One is National Hospital and second is Regional Hospital. If you go in, this is the main hospital for plastic surgery, and it was in the 2nd floor, and at 3rd floor there was vascular surgery. This was the entrance, and this is the hallway. You can see this on the hallway of the hospital. It says that if you don't get surgery, you usually, because we're at the National Hospital, the minimum you pay is about $5. The maximum you pay is about $1,800 and $180, and this is the average. Also, if you get surgery, there was not a big difference. So this is the average amount, even if you perform the surgery. So the compensation there is not really well organized for the hospital. This is the outpatient clinic. This is the dressing room. And this is the inpatient ward. There's no curtains or divisions between patients. They all stay together. This is the operation room. Very good view. And this is the microscope they have. This is how they keep the aseptic gauzes, and they use these glasses to make it sterilized. And also this is JP. They have a IV line connected to a syringe and use the syringe for negative pressure. This is the ICU. When they perform general anesthesia, they all send the patients to ICU and keep about 3 to 4 hours of ventilation because they don't have to reverse. And this was a photo at the ICU. They were taking back the soul of the patient. This is the place where professors and residents were staying to do some paperwork. This was where we stayed, and this was the place for rest. So, yeah, there was 5 days for missionary when we first arrived. Day 1 to 5, and day 1 it was for the day for outpatient clinic and preoperative planning, and day 2, 3, 4, 2, 3, 5 was for surgery, and we had a microanastomosis workshop and symposium at Thursday. That was the first day. There was many patients, also cellulitis patient. Peter, we gave him antibiotics and educated to him to elevate his leg and start compression when this infection goes off. Also, there was many burn patients in the hand. This was, we saw in the road that they eat many teas and very, very hot. Those pots are really outside the hallway, so they are really vulnerable to getting burns. Also, this patient got, I remember it's a radial bone fracture, but she did not got a proper reduction and proper management after the surgery. They just left it like this. So total movement loss at the wrist and the hand. Also, this patient got the venous malformation excision, and after that, the ulnar nerve was injured, so she couldn't use his ulnar side, hypotenar side muscles. And this is the x-rays and MRIs they showed us. It was in the film that we used in the past. Also, there was many lymphedema patients too after cancer surgery. So with the bandages they had, we educated them the compression. And also, they didn't did the head and neck surgery, so there was a maxillofacial surgeon, and Professor Jung went to meet him and talked about reconstruction and maxillofacial surgery. Also, when we have time, Professor Peter gave lectures to the residents and professors about diabetic foot reconstruction and negative pressure wound therapy. This patient was the patient we did surgery at day 2. This was the preoperative visit, and we previously knew the patient, so we prepared 2 tissue expanders before the flight. So, and also this is the patient we did surgery at the day 2. Yeah, the little finger was also lost, and there was a soft tissue defect with tendon exposure and bone exposure. So day 1, this was the first patient I just showed you. Professor Jung performed tissue expander insertion, 1 in here and 1 in here, and also saw the patient afterwards and educated the doctor in Kyrgyzstan to how to inflate the tissue expander and when to do the second surgery. And this is the photo of him and the patient afterwards. She's very happy. And yeah, this was the second case of the day 2. We discussed a lot about this patient, but thinking about Kyrgyzstan's their facility, and we performed an abdominal flap. So Professor Kim did the surgery. We connected this tissue to his abdomen, and this is the post-operative photos. The flap is doing good, and they will do the division about 1 to 2 months after. Yeah, and this is the post-operative dressing photo. And I was on duty on day 3, and I saw a patient that had some trauma on his index finger and middle finger, and they performed a groin flap 2 at this patient. And at day 3, Professor Kim performed delayed DIP reconstruction for right breast cancer. So we did an anastomosis at the perforator of IMA because in OR we didn't have suction and we were running low for the clips. So when there was a problem while dissecting the IMA, that could be a big problem for us. So we found a big perforator IMA, and we also elevated the flap and connected, and the operation was completed. And they didn't have the abdominal band and the brassiere, so we did with the haft. And this is a photo. The patient was also happy, and this was what we wanted to show about Kyrgyzstan, that breast can be reconstructed, about breast reconstruction, and also the microsurgical free flap operations. And I think this was because Professor Jung went to the maxillofacial at the first day. They consulted us for another patient during the week, and this patient had a titanium exposure on his scalp with a dura under the titanium. So Professor Jung founded a perforator at the anterolateral thigh and found also the recipient for superficial temporal arterial vein. So we had a joint operation with the neurosurgeon and removed the implant and elevated ALT. Well, actually it was AMT, and did the microanastomosis. And the flap was doing good, and until, the flap did well. So at day 4, we had a micro workshop. Before this visit, Professor Peter gave this microscope to the team. They were practicing with it. And day 4, Professor Kim gave a lecture about microanastomosis and did 1-point lesson to the residents there. So he taught everyone and gave some feedback about microanastomosis, and this was some sort of certificate or a memory to take on. And at the same day, we did the Asan KSPS Joint Symposium. Professors all gave the lecture, and also plastic surgeon at Kyrgyzstan gave lectures for the residents and other professors and colleagues. So this was the photo of the symposium. Also, Rustam gave a farewell lecture about Asan Medical Center at the symposium. Many residents and doctors came to the symposium. And also, we awarded the KSGO Plastic Surgery Award. The fellowship was awarded to Rustam and gave the certificate and both the prize. And also, this is Dr. Sultan, who's the president of KSPS in Kyrgyzstan. He gave us a gold medal for every professor to say thank you. And this is the group photo. So, I think everyone knows this is Dr. Rustam. And this is Maksud, who also performs a lot of clip surgeries on Kyrgyzstan. President Sultan and Kisha, Sir Kanat, and Kazir and Shashat. It was the day when I was on duty. And Ali Shar, we went to Isikul River together. And this is when we were in the last day, they gave us the whole lamb. This is the whole lamb, and they showed this some kind of performance. They cut it in front of us, and if you can see, this is the head. And by their tradition, head is given to the most respected one. So the head was given to Professor Sa. And he ate it also, And food there was really fantastic. There's very good lambs and very good beef. Lamb, and this is horse intestine, and also every part of the horse beef. And I miss this food. This is called manti, Kyrgyzstan mandu, and many other food, samsa, and I hope all of you can visit Kyrgyzstan. And we were really 말 생각이 안 나. They had so nice hospitality for us. They took us for very good sightseeing places and very many restaurants. And also, this is the last day. We went to the Isikul pond, 호수, and there's a very big pond that is about 200 kilometers long. Lake, sorry, lake. So, yeah. This is the day when we went to the lake. We all swam together. This is Professor Seo, Professor Kim, and where's Professor Seo? Here. And the nature was so nice. And I really express my gratitude to all the friends in Kyrgyzstan and all my professors and colleagues for giving me a chance to visit Kyrgyzstan. Thank you.
So what did you feel after coming back?
Well, the feeling there was so, when I was there, I was so touched, and I made good friends and connections at there. But when I came back, the OR was so different, and what I'm getting trained and what I'm learning is a really sort of privileged, and I should really be grateful and happy about it. So I feel very humble and want to, that's the first thing. And second thing, I wanted to also, when I become old and experienced, I want to also go for missionaries like Professor Seo or Professor Oh or other professors, that I can help other people if I have the chance to.
Any questions? This was my third and the second visit as Asan-in-Asia program. So we're gonna visit Kyrgyzstan for at least 3 more times, and after that we're planning to visit every year, not only to do the surgery, and but also we want to help them to build the reconstructive surgery in Kyrgyzstan, and they have the passion to do the things we are doing in Korea, and there's something we can help them to develop fast. So it's really fun thing to do together. And there will be some reconstructive surgeon in Kyrgyzstan, and they're gonna come next year to visit us together and have a fun time together. Okay? Thank you so much. Thank you.